Next, we have Professor Serafín, and the talk is titled Neuroinflammation and Suicide Risk, Exploring Biological Markers and Assessment Tools. Hello, Professor Serafín.
Hello, do you hear me?
Yep.
Yeah.
I can hear you.
I wish to share my slides only to understand whether the system isn't functioning. Yeah. Do you see my slides?
Yes, it's all right. Yeah, it's all right.
Perfect.
Before continuing, can I ask you, can we please record this and then share it on a YouTube channel with other students?
Yeah, absolutely.
Thank you.
With my pleasure.
Thank you very much. Thank you very much. It's a pleasure. Go on.
Can we go?
Yes, sure. Go on.
Okay. Thank you very much for this invitation to present such a topic. And my presentation will be on neuroinflammation and suicidal risk. And in the effort to identify possible the last 20 years of my life to as a clinician, but even as a research, it's a medicine. So about neuroinflammation, there are many ways in which the immune system affects the brain. Microglia enter the central nervous system very early, playing a relevant role in both healthy and diseased brain. B-cell diversity contributes to brain damage in many ways, and we are only at the beginning of this fascinating journey in which we have begun to understand the complexity of the interaction between the central nervous system and the immune system. B-cell mechanisms are related to brain damage, and so it's very important to understand how these conditions may affect the brain. And here we have to understand the complex nature of disease, of neuropsychiatric conditions, starting from the prenatal life to childhood, adolescence, adulthood, and the late life. In short, the vulnerability and early brain development. And here we have now many evidence. We know that many are able to act as stressors. And here you may see the that my presentation we in the image which is that is connected, is linked to both neuroinflammation and suicide. Here, as you may see, it's very important to understand how the prenatal environment and how the early exposure to stressors is able to identify some possible alterations which are able to disturb, which are able to impair the migration of neurons in cortical development. As you may see, substance abuse, but even many drugs such as serotonergic, such as valproate, or many more, are able to interact in these complex migration trajectories of neurons. And all these conditions are able to disturb the neuronal, the cortical development. And as you may see by the scientist, the prenatal exposure to specific drug abuse, such as alcohol or cannabis, and many more, are able during pregnancy to identify higher rates of depression, hyperactivity, and suicidal behavior. This is very important because the federal government in the United States clearly demonstrate that these conditions are able to modify the brain development. And then there is also the role of maternal immune activation, abnormal maternal immune activations, which is mediated by pathogenic infections. We have understand this about the recent COVID-19 pandemic situation, in which it was possible to understand the many complex conditions and consequences related to this infection. And here there are many papers about this. We need to understand more directly the MAGE, which is clearly related to pathogenic infections. And starting from specific stressors, we can identify the systemic allostatic overload, and this systemic allostatic overload may be manifested through three specific pathways: the metabolic dysregulation at the first point, the hypothalamic pituitary adrenal axis dysregulation at the second point, and the inflammatory changes at the third point. All these impairment pathways are able to identify, are able to be mediated by the placental, the alteration of placental integrity, and all these conditions need as contributors of the neuropsychiatric risk, the increased suicide risk in a specific case, acts as an integrator, as a propagator of this allostatic overload. This is very some years ago, we published this paper with my research group, in which we have clearly demonstrated that initial stimuli such as stress, glucocorticoids, drug abuse, and increased age are able to impair the neuronal plasticity. And importantly, there are also even other conditions such as the use of antidepressants, environmental stimuli, and physical exercise and learning, which are able at the opposite to restore the morphological integrity of the brain, to restore the neuronal plasticity and synaptic plasticity in specific neuropsychiatric conditions. At the beginning, we may see that an initial stressful life event, such as early childhood experience, early traumatic experience, is able to affect the long-term functioning of the immune system, because early childhood stress remains for many years in the immune system of these subjects, and even after many years is possible to identify these immune biomarker of the early traumatic experiences which has been experienced many years ago. When we look at the literature, we found that there may be several brain regions implicated in immune alterations, and there is also a complex interaction between endocrine system and immune systems, and there are many papers about the role of cytokines, pro-inflammatory cytokines, which are related to brain damage. However, the situation is more complex because we cannot ignore the role of other populations, such as astrocytes, such as mast cells, such as microglia, or the complement. So cytokines are able to specifically impair some mechanisms in the brain, but other cells in a very complex way are involved in cell damage, in the brain damage, and in the alteration of brain development. And this is from the historical research group of Charles Nemeroff, which has been published on Neuron some years ago. In this paper, you may see that depressive symptoms are related to specific alterations in neurotransmitters, serotonin, dopamine, and norepinephrine. But interestingly, specific symptoms such as suicidal ideation are related to impairments, to alterations in specific levels of EL6, EL2, EL8, TNF, and so on. Unfortunately, it's very difficult to identify these as potential biomarkers of suicide, but I believe that these may be interesting candidates in order to identify possible more reliable biomarkers in the future. So we need to understand that not only neurotransmitters are related to symptoms, but even the alteration of specific biomarkers, immune biomarkers, are related to specific symptoms, and in particular to suicidal ideation in this case. And during neuroinflammation, it has been observed for several times a dysfunction at the level of the kynurenine 3 monoxygenase enzyme. This is a very interesting target because during the neuroinflammation, the dysfunction at this level is related to the overproduction, to the over-release of quinolinic acid, and the quinolinic acid in the microglia needs to be identified as a potential alteration in the brain, directly related to oxidative stress, directly related to excitotoxicity, linked to glutamate. You know that glutamate is the most relevant excitatory neurotransmitter in the brain. So this happened during neuroinflammation, and some years ago we published this systematic review in which we found a direct correlation between abnormalities in kynurenins and treatment-resistant depression and suicidality. At this level, we found that the glutamatergic agonism is able to contribute to both major depressive disorder, treatment-resistant depression, and in particular suicide. So the kynurenine abnormalities need to be identified, need to be recognized as another potential biomarker in order to understand the complexity of suicidal behavior. Is really a very complex phenomenon. We understand clearly now, according by the neuroinflammation is possible abnormal concentration of quinolinic acid, used levels of quinurinin acid, which in this case is an antioxidant. So identify this imbalance in order to understand how the brain damage is proceeding. And some years ago, we published another paper in which we tried to analyze this condition. In the microglia, we found increased quinolinic acid. In the astrocytes, we found increased glutamate release, and in the oligodendrocytes, we found a reduced concentration of trophic factors. All these conditions are selectively related to suicidal behavior. And here, this is the complexity of the neuroinflammation in the brain. We have not only one actor in this condition, but we have also many actors playing a significant role as a contributors of suicidal behavior. And the neuroinflammation, and in particular the elevation of pro-inflammatory cytokines, are able to produce a dysfunction in the telomeres. Telomeres are very important because they are involved in the integrity of chromosomes, and in particular they are related to both structural and functional brain changes. So the accelerating aging, the inflammation are able to directly affect the pathogenesis of psychiatric disorders and suicide. We also found in the peripheral blood of patients with major psychosis and suicide the abnormally elevated concentration of T lymphocytes CD4 central memory, and the reduced concentration of T lymphocytes CD8 effector memory. And this is a finding which has been replicated in many times. So we investigated a possible correlation with some central finding. So we found in the peripheral blood the abnormally elevated concentration of T lymphocytes CD4 central memory, and we found a reduced cortical thickness in association centrally in the fusiform gyrus and the precuneus. These are very important brain areas which are related to neuropsychiatric conditions and suicide. And in the same paper, which we published in Journal of Affective Disorders, we found that these abnormal levels of CD4 in the peripheral blood of these subjects is also related to the damage in white matter. And this is another important thing. We found this correlation that needs to be replicated, but this is an initial step in order to understand the complexity of the neurobiology of suicide. And then we also analyzed NK cells. NK cells act as immune regulators, immune regulatory cells underlying many neuropsychiatric conditions. A specific role in fighting viral infections has been reported for NK cells. So we analyzed a sample of 78 subjects who are affected by bipolar disorder and schizophrenia, and we found that by the clustering data-driven analysis, we have two groups. The C group is the group of patients, and this group of patients is importantly show the expression of two distinct biomarkers in the surface, the NKG2A positive and the NKP30 positive, and these need to be recognized as potential biomarkers of this specific population. We submitted this paper some days ago in a journal, and here I have only preliminary data about this. The cells, the NK cells with the double positivity of these two biomarkers seem to be more protected than other cell populations, and this is a very interesting finding from the general, and which is not present in the general literature, because when we analyzed the potential link with the clinical measures, we found that these subjects are more protected than other subjects. And the same is confirmed for the Psi group, which showing a less altered profile at the MRI data when we trying to analyze the correlation between this specific NK cell of these subjects with the MRI data. And so, in the summary, this population, these subjects seem to be more protected even for the brain damage if there is present this specific population of NK. So this is a very, very complex situation. Starting from the external stress, it's possible to identify some specific conditions and later to identify the final result, which is the reduced neurogenesis, the increased apoptosis, and the increased cell damage in these patients who are affected by neuropsychiatric conditions and are recognized to be at suicidal risk. Possible pathogenic factors playing a role in brain damage. Here we have a very complex situation, and we can initially identify at the first step some molecular patterns in response to injury which are related to the alteration of the permeability of the blood-brain barrier. This is only the first hypothesis. There are papers about this. In molecular psychiatry, it has been published very recently, this paper, in which it has been clearly demonstrated that in response to injury, the damage-associated molecular patterns are released, and these damage-associated molecular patterns are able to identify the abnormal release of specific cytokines, such as IL-10 or TNF-alpha, and so on. We have also identified another possible biomarker in the alteration of the resilience of the blood-brain barrier. Here, in the left, at the left of this slide, you may see the resilient blood-brain barrier in which the tight junctions are very, very close on each other. And on the right of this slide, you may see that the tight junctions are dysfunctional, and possible neurotoxic agents are able to pass through the barrier and to begin an initial brain damage. However, another possible hypothesis needs to be found in the microglial functional imbalance. Microglia is able to receive signals from many conditions, trauma, infection, alcohol, dietary restrictions, and so on. And an excess of activation and overreactivity of this type of cells are able to impact on specific psychiatric conditions and even on suicide. Here you may see a post-mortem study in which it has been found an increased density of activated microglial cells in the ventral, but in particular in the dorsal prefrontal cortex or white matter of subjects who died by suicide when compared with subjects who die from other causes. This is a very important study from which we have to understand for another time the complexity, but in particular the abnormal activation of microglial cells in these brains of subjects who die by suicide. And the alteration of microglial is able to affect neurogenesis, is able to affect neuronal plasticity, and so this is an example of this type of dysfunction. As you may see morphologically, this type of microglial cell is alterated, and these alterations is able to impair the neurogenesis at multiple levels. At the third point, there may be an important CD8 immunomediated damage. This is the third hypothesis. Our research group published a paper about this on molecular psychiatry some years ago, in which we found a direct damage which is related to CD8 abnormal activation. These cytotoxic cells may contribute significantly to the brain damage of specific areas in the brain. And even when looking at post-mortem studies, it's possible to identify an increased T lymphocytes density in patients who died and in their history it's possible to identify the presence of mood disorders and suicide. Also, very interestingly, according to neurobiological findings, dysregulation in the Tregs, the FOXP3 destabilization. This FOXP3 is a transcription factor which is involved in the increased capacity, in the increased ability of these cells to contribute to the brain damage. And it's very unclear whether Tregs dysfunction is able to act directly or even by IL-6. And so IL-6 needs to be recognized as important biomarker. Again, we have in the final slides, we have to understand the important role of beta-amyloid deposition and the loss of myelin integrity. There are many papers about this, and we need to identify the importance of cellular and molecular changes which are initially induced by the increased age in subjects. These processes are able to determine a later accumulation of beta-amyloid in the central nervous system, and this is a main contributor of neuropathology. And this is from Nature. It has been published on Nature. Here in this paper, the authors hypothesized that initially there is a loss of myelin integrity, and this loss myelin enable accumulation the beta amyloid in the brain, and this may be integrally related to the pathogenesis of suicidal behavior. And finally, we have to understand the role of NK dysfunction. Here we have, for another time, our preliminary data about the protective pattern, as you may see by this configuration, by this profile, when the NK cells show this type of markers. In this condition, we found a reduced negative symptoms, an increased structural integrity of the white matter, and a less altered cortical thickness of specific brain areas. There are also other papers confirming this data. And so NK protect the white matter integrity microstructure specifically in psychosis, in affective psychosis. And finally, another possible explanation needs to be explored in the role of possible pathogenic agents such as cytomegalovirus. Cytomegalovirus is of real interest because is able to be identified in these subjects initially, and it's possible that cytomegalovirus is the main contributor of this NK dysfunction, who later in life seem to play a significant role in the emergence of schizophrenia, in the emergence of bipolar disorder, and even in the emergence of suicidal behavior. So we need to consider specific limitations of this topic, the small sample size, the need to control for relevant confounding factors. However, we know at this time that immune biomarkers are very, very interesting, even not only for the prediction of illness onset, but even for the prediction of illness progression and suicidal behavior. So we need to restore this imbalance. As you may see, prodromal subjects seem to be more predisposed to vulnerability. Our intervention need to restore this imbalance. Challenging situation for the future, but I believe that the neurobiology at this point provided as some possible initial instruments in order to address this type of imbalance. Thank you very much for your attention.
Thank you very much for your thoughtful speech. There's just a question a participant asked. Are abnormalities in immune system markers such as reduced CD4 counts or pro-inflammatory cytokines linked to increased suicide risk primarily through their effects on depression, or do they contribute via their mechanisms as well? In other words, is the pathway predominantly mediated by depressive symptoms, or can immune dysregulation have a more direct role in suicidality independent of mood?
Yeah. Thank you for this very interesting question. This is a question which is present in most of our general literature or scientific literature. In many cases, it's very, very difficult to distinguish the sample of subjects were affected by suicidal risk and even from major depressive disorder or psychiatric conditions, and to distinguish samples who are not affected by neuropsychiatric conditions. So this is a very, very confounding factor in the literature. And the second part of the question is related to the importance of markers. Unfortunately, it's not possible to identify a specific reliable biomarker which is directly related to suicide. EL6 is, in my opinion, a possible interesting candidate in this case. But EL6 is also altered in depressed patients. So we need to disentangle the complexity at this level.
Thank you very much. Thank you very much for the time you've given us, and we appreciate your contribution today. We'll be in touch for more collaborations later. Thank you.
Thank you. Thank you very much. Bye.